Hi, I'm Shelby, and today my video is going to talk about Constructivism Theory. We have a few objectives here. We're going to list the components of Constructivism Theory, describe the historical evolution of Constructivism, list strengths and weaknesses of Constructivism, and several ways to use active learning in class that account for Constructivism. Constructivism is a philosophy applied to education, which posits that learning is personal, contextual, and occurs in our own existing cognitive framework. Essentially, as you watch this video, your brain is trying to make comparisons to things you already know, so you can try to make sense of the new information. Although this may be an oversimplification, when asking a new person their name, you would try to think of a person you already know with the same name to try to remember. There are three main theories to constructivism: exogenous, endogenous, and dialectical. In the next few slides, we'll define each of them. In exogenous theory, knowledge is built by reconciling one's beliefs and experiences from the outside environment. Similar to behaviorism in some aspects and social cognitive theory in others, learning is acquired by interacting with the external environment. In the picture to the right, learning to sew a laceration would involve observing a skilled practitioner perform the skill and the student processing this information in their mind. In this theory, knowledge is true for the learner as long as it reflects their experience with the outside environment. If all you knew about suturing were from observing it happen when asked, "Do all lacerations require suturing?" you may not know why not, since you haven't had a wider experience with suturing. By contrast, endogenous constructivism posits that learning occurs by cogitation. In the previous example of suturing, real knowledge would only occur if the student had an instructional session about lacerations and suturing with the instructor. By thinking about suturing and cogitating on the what, whens, and hows, the student incorporates this knowledge into their brain. Dialectical theory takes advantage of both previous theories by exploiting the schisms or tensions between them. If we keep with the suturing example, when asked, "Do all lacerations need to be sutured?" your learning would occur by working through what you already know about suturing and what you saw. You would make arguments for or against based on those two things. By working through the differences between what you know and what you observed in your mind, you construct this new learning. One of the bases for constructivism lies with the theories of Russian psychologist Lev Vygotsky. His social development theories posit that learning occurs across stages of development as children interact with their peers, their environment, and their culture. As these interactions occur, the child develops skills, and learning is formed by guidance and instruction. Vygotsky's theories about development are dependent on culture. Adults teach children about the environment according to their culture and guide children through skills. The child begins as unable to perform a skill. By practicing, learning starts to occur. In Vygotsky's zone of proximal development, the child can only perform a skill with help. With more learning, the child is able to master the skill and can perform without help. Vygotsky's theories about learning also have a lot to do with language. His work and the work of other psychologists explain the way humans learn by the way we learn language and speech. Speech and language are key parts of our social interaction with others in our environments. Socially mediated learning and learning language are also involved in our self-regulation skills. Jerome Bruner, another psychologist, posited that learning occurs when children interact with their environment, similar to Vygotsky. This occurs through language, observation, modeling, and children trying out their skill development. Learning as a discovery process and the writings of Bruner help form the basis for constructivism. Based on the theories of learning from Bruner and Vygotsky, as well as numerous others, that learning is a process derived from interacting with and thinking about our environments. As we learn skills, language, and how to interact, we are developing a mental framework. As educational pedagogy moves in a direction of flipping the classroom, there are numerous ways we can use learning exercises rooted in constructivism. Discovery learning, which is a term coined by Bruner, is supported in educational design, but only as students are guided through it with meaningful instruction. Flipping the classroom is an inversion of Bloom's taxonomy, where students are guided through active learning in class. With instructor-facilitated active learning, students are constructing new knowledge, like taking bricks and constructing them into something real and meaningful. Based on constructivism, they must juxtapose new concepts and skills to existing knowledge and are encouraged to reconcile them. In this triangle, active learning is at the bottom of the pyramid based on the amount of work the learner is performing. The more active a technique, the better we remember. If classrooms are using passive techniques, students are not meaningfully learning material. Flipping refers to flipping Bloom's taxonomy levels so that instead of spending class time hearing lecture and taking tests, which use low levels of remembering and understanding, students spend in-class time performing tasks we often had them do as homework. Classrooms become places where students are engaged with the material, the instructor, each other, and are really learning concepts in a more meaningful way. Homework becomes the reading and the lecture, and the working through problems and learning skills comes back into the class. Flipping is supported by constructivist theory, as student learners are going through the process, even at a higher level like post-secondary education, of learning described by Vygotsky and Bruner. Students are coached into how to interact with the course material and their environment during class time. Some limitations of constructivism include its wide philosophy. There is no universally recognized theory, rather it has been applied to education and practices with varying success. What studies in learning do show is that student learning, even with active techniques, is really only meaningful if it's guided. This means the teacher is also active, providing feedback, using discussion and collaboration, modeling skills, affording practice, and allowing students to learn from experimentation. Another criticism of the theory behind constructivism is that learners with less existing cognitive framework or structure are less able to incorporate new information successfully. This also underscores the need for guidance. The facilitator's role is to examine learner deficiencies if we ever want to make mastery our true objective. There are many techniques that can be used in the classroom to engage students in guided discovery, such as the ones listed here. We'll talk in a little more detail about the first three. Problem-based learning works wonderfully in health professions education. As a process, it mirrors constructivism in that it presents learners with a problem, and students dissect both the process for how to solve the problem and are guided through the steps to resolution. In medical education, patients usually present with a problem or a set of symptoms and seldom walk in with a diagnosis. With guidance, small groups can walk through how to solve the problem using their existing knowledge of medicine while building new knowledge. The later a student is in their education, the process can become more sophisticated and really result in some meaningful learning. In problem-based learning, students are not only learning about the material, they're learning how to think about solving problems. Problems are analyzed, resources reviewed, existing knowledge is discussed, proposals are developed, and theories tested for validity. Evaluation of these tests help modify theories until the problem is resolved. Concept mapping is a skill that's rooted directly in constructivist theory. The idea that students take a concept or idea and create a visual map of issues related to it. They take a large concept or idea and break it down into its smaller parts. As students become more adept at making concept maps, they begin to identify interconnections between the smaller components. One drawback to this technique is that it does have a learning curve for both students and faculty. Concept mapping is also known as mind mapping and is a graphic representation of information. Maps can be created with software or in hard copy with paper and pen. With time and experience creating concept maps, students organize their thoughts about a subject. As knowledge about the subject grows, the more complex the concept map becomes. The most sophisticated maps reveal connections between the foci on the map. Simulation has been shown to enhance skill level and reduce complications in medical education and with working medical professionals. The old adage of see one, do one, teach one in medicine may not be the best for patient safety. Study after study support that humans increase their skill level by doing. In the photo, someone is inserting a central line into a patient's neck. If you were one of the people in the photo, you'd have wanted to see one performed by an expert, then taught on a mannequin until you felt more competent before performing the skill on a real patient. If you were the patient in the photo, you'd certainly want to know that the person placing your central line was skilled at doing so. Finally, simulation is even more meaningful with guidance. Experts demonstrating skills, providing formative feedback the entire time, and debriefing at the end of the exercise. Simulation is also supported by constructivism and discovery learning. As students interact with the simulation equipment, observe their peers and instructors perform skills, and apply knowledge about the subject matter, they're incorporating new skills into their cognitive framework. Feedback, students can refine skills, hopefully to achieve mastery of the material. It's constructivism in action. Sometimes students are learning about things in class they don't understand well, or feel unable to do, or can't see how this information is going to be applied. By helping students structure new learning into their existing cognitive framework, we're helping guide them and make the new learning make sense. In conclusion, constructivism theory has numerous positive implications for teaching and learning. As we flip our pedagogy to use active learning and view teachers as facilitators guiding students through course material, we can assist students in building new information into their cognitive structure. Thanks for listening to my presentation. I've added a few resources here of interactive websites you might find helpful.